Well, good morning, everyone. Happy Friday and welcome to COVID-19 Vaccines in Our Community series. If you are just joining us today as a first-time visitor, thank you so much for tuning in. If you've been following us along during these various conversations, we thank you as well for continuing to be engaged in everything that we've been talking about. I'm Jennifer Pascua, Lead Community Relations at Spectrum Health, and this morning we'll be spending time offering you the opportunity to connect with community experts. And throughout our dialogue, we want to hear from you, our viewers. So please, we're asking that you post any questions or comments in the comments section or whatever platform you are joining us from. And so this is a special presentation today. As you can see alongside us this morning, we have interpreters who will be joining us throughout this broadcast to provide us the sign language interpretation for those who are unable to actually hear what we are talking about today. So again, thank you so much to our interpreters, Lydia Hansen and Laura Clark, for joining us in this conversation. So let's get to it. I want to introduce our panelists today, and I think we can just bring them up one by one. We're going to start off with David. Good morning, David. Go ahead and introduce yourself and where you're from.
Good morning, David Knibbe. I'm the president and CEO of Evergreen Commons. And Evergreen Commons is a wellness place for older adults. We serve over 4,000 members in our greater community in Holland Zealand area. And we also have adult day services for adults who need assisted care for the day. 65 plus is generally our focus. About 90% of our members are 65 plus in age.
Yes, and our topic, of course, focusing on that older population. And how long have you been around in our community, David?
Evergreen Commons opened its doors in 1985. So, 35, a little over 36 years. So, yes, serving the community as originally we used the title Senior Center, but over time we've just switched it to a community center for older adults.
Right. Okay, thank you so much for your introduction. Next up, we have Bill, and I believe we can bring Bill to the screen.
Good morning. I'm Bill Kerans, the director of the Scottville Area Senior Center in Mason County. We are one of 4 senior centers in our county. And like our colleagues at the other centers, we offer a wide variety of activities for seniors. We also have a unique role in our county in providing county-wide services in-home through our in-home aides and medical transportation up to 100 miles away through our volunteer drivers.
And Bill is not a black box. We're going to hopefully get his camera up and running in just a few minutes. But Bill, we thank you. How long has the Scottville Area Senior Center been around?
Since 1973.
1973. So clearly a staple in that community.
Indeed, we are.
Yes, there we go. Good morning, Bill. We see you now. Thank you for being here.
I would like to add, Jennifer, that we're part of the Mason County Central School System. They took on the role of sponsoring a senior center many years ago, which was very much needed in this area, and have continued in that leadership role through all these years.
Well, thank you for sharing that history of the center, Bill. Up next, we have Allison Maat. And Allison is joined with Danielle Gleason as well. So go ahead and tell us what you do, ladies.
Good morning. Thank you for having us here today. My name is Allison Maat, and I am the Programs and Community Relations Coordinator here at the Newaygo County Commission on Aging. And I have one of my coworkers here with me.
I'm case manager here at Newaygo County Commission on Aging.
And describe for those who may be tuning in and may not have any idea of exactly what the services are that you provide.
Yes. So here at the COA, we have 3 congregate meal sites throughout Newaygo County. We have various bus routes that bring participants to our meal sites and errands. We also do medical transportation for our clients. And then we have a volunteer medical transportation as well that bring clients to specialty appointments outside of Newaygo County.
Fantastic.
We've got a lot going on. We also do Meals on Wheels, currently to about 225 individuals around Newaygo County, as well as in-home services, homemaker program, where we have homemakers that go in and do light cleaning, errands, and laundry.
Wonderful. And Danielle, you work closely with all of those projects as well.
Yes, yep. One of the case managers for that and helping with our vaccine stuff here in Newaygo County.
Yes, and we'll certainly dive into that. So ladies, thank you again for being here with us today. And finally, rounding out our panelists, we have Mona Hale. Mona.
Good morning. Thanks for having me. I am a nurse practitioner with Caring Circle, Spectrum Health Lakeland. And as one of the many nurse practitioners on the medical service, we provide services for our patients in the 3 clinical arms of Caring Circle, which is the house call service, the palliative service, and our hospice primary service. Those programs are providing service in the home setting as well as in the hospital and at our hospice center. And so one thing that's very unique about Caring Circle is in the continuum of care, they can rotate from one palliative service for acute symptom management into chronic care management, into the home setting, or into hospice services without having to change their provider. So that's really important with the elderly population when they're trying to maintain those relationships during transitional times of care.
Yes, it certainly is. Well, thank you, Mona, for being here and to share time and expertise with our conversation today. So we're going to just dive right in. I want to start with David. If we can bring David to the screen, I want you to tell us right now, David, what are the conversations that are happening at Evergreen Commons, and share a little bit about the efforts that are taking place in terms of vaccination information.
All right. So before COVID, we had about 600 folks coming through our doors on a daily basis and doing all kinds of activities. Was land fitness classes, water aerobics, wood shop, congregate meals, all kinds of just activities that brought life to the folks who came. And of course, in the COVID period of time, we needed to, like everyone else, shut down. Currently, we are opened again, but partially following all the current limitations. We do have some programming going on. And of course, the conversation is that, well, how long and can we get this vaccine? And if we did get the vaccine, when can we start eating with each other without masks? And all of the questions that have been out there for pretty much everyone, but exclusively for the older adults, because they have been the ones who have been most vulnerable to this particular coronavirus, and therefore they've been the ones who are most at risk, and they're wondering when can we get access to the virus, and when can we start gathering again socially and being with each other, which is so critical to our health, right? So a lot of those conversations are there. Right now, we've been able to partner with Ottawa County Health Department and with Holland Hospital and get access to some vaccines. And so we are running some mini clinics at Evergreen Commons. In fact, today there's a second dose clinic at our facilities. And so we're able to access some of that through Holland Hospital. As you know, some of the portals go through the hospitals and then through the health department. So that's exciting. And that's, I'll tell you, bringing folks out for the first time in 10 months just to be able to get this vaccine and the hope that it brings.
Can you share with us, beyond the age demographic, the other demographics that we are seeing for your clientele?
Well, inside of, the age demographic, which primarily is our probably average age is 72 plus, there are other demographics in there, lower income, people of color, the Hispanic community, the Black community, and others as well. The Laotian community is pretty high, the Asian community in our area. And so we've made special effort inside of our facility, our organization, with our Hispanic staff or African American staff to reach out to particular churches and to other organizations to be sure that we're doing all we can for them to have access to the vaccine. And those efforts are going on not only with our organization, but also Lakeshore Nonprofit Alliance, which is an organization here in our West Michigan community, connecting with the Ottawa County Health Department. So we're making sure that we cover all the particular area, or I should say demographics inside of demographics, who historically maybe haven't had access to these kind of, whether it's vaccines or other resources that are particularly at risk if they don't have them.
Yeah. We'll get into that a little later in the regards to the how. Bill, given that you are in a rural area, are there more challenges that you're experiencing over there? Perhaps Bill's frozen. Gotta love technology. I'm going to go ahead and get back to Bill in just a moment. So let's move now to Allison. Allison, and Danielle, both of you have heard what David had to share. Give us a take on your end, what you're seeing and what you're hearing from some of your clients.
Yes. So Newaygo County is a very rural area as well, especially northern Newaygo County. And it's been a struggle for our clients to get vaccines and to get signed up for a vaccine. At first, everything was really online, and a majority of our county doesn't even have wireless internet. And then especially our senior population, I would say about 90% of the people that I talk to do not have internet.
Yes.
So for them to have to utilize the internet to get signed up for a vaccine was very frustrating and really not doable. So we are very thankful that our district health department, as well as Spectrum, has come out with a phone number that we're able to give people. And Danielle, in the beginning, I don't know if we could share a story about how Danielle really helped those people that were very, very frustrated because they couldn't get online.
Yeah, absolutely. I would love to hear that story, as would many of our other guests who are joining us right now. So yeah, take us through that moment.
Yes, we didn't have any structure for people to call, and that's primarily how we communicate up here. And so they were able to call into the Commission on Aging, and we set up our own waiting list so that once we were able to register them and go online, we could do that. And then also we got a call because we've been trying to partner with our health department up here too. And they had 70 doses of vaccine, and they said, we need to put these vaccines in arms, and our clients are clamoring for them. This is their hope. This is their, they've been inside for 10, 11 months. So this is what they really, really need. And we were able to, through the word of mouth, through calling and reaching out and old school prayer chains, we were able to bring in, the 70 people that they had doses for. And that was a wonderful, example of collaboration with our health department. And I'm so thankful that Spectrum and now our health department do have a phone number, because there just wasn't a way for them to feel like they were, part of this otherwise.
Yeah, to feel connected, I can imagine.
Yeah.
So I'm going to take a pause now so that we can switch out our interpreters. And as we do that, hopefully we can bring Bill on the screen. Let's see if we can do that. Good morning, Bill.
Good morning, Jennifer.
So let's talk about your area there and the challenges and barriers you're facing.
Well, there are some significant ones. Similar to Newaygo County, we have a very a rural area in addition to our cities such as Ludington and Scottville. And so the population is significantly dispersed throughout the area. There are significant public transportation issues in our county. We have a public transportation system which is very effective, but it does not cover the entire county because we have a system where townships opt in by providing financial support for the system, and all townships have not decided to do that. So for instance, if one of our seniors wants to go to Meyer, they cannot get a dial-a-ride to get to Meyer if they because the service does not go into that particular township. So we have not only the problems with limited Wi-Fi coverage, and we're trying very hard to correct that by a countywide initiative to improve Wi-Fi service throughout the county. And we've installed some hotspots around the county. I don't mean we have as the senior center, but speaking broadly of our community, we are working to counteract that difficulty in having online accessibility. So those are some of the significant challenges that we face as a more rural area.
Yeah, I'm hearing a theme, the access. We talk about access to internet. We talk about access transportation wise. Can I ask specifically to you, Bill, if you could share too the demographics within your area beyond age?
Well, the demographics here are fairly rapidly shifting toward an older population. Our activities coordinator did some research on this recently, and since 2000, we have increased from 16.8% of people 65 and older to now we're at 22.9%. And if you include people 50 and above, which is the population we tend to serve, we're talking about 45% of the 28,000 plus people in Mason County are above that age.
Right. Well, I've got a question here from our Facebook page, and maybe I can toss this over to Mona. A question I think many families and many older people are asking. The question is, why can't my husband get his vaccine? He's 71. Has been registered since early January. And if you could maybe take us through the behind the scenes reasonings for this, for those who have been on the list and remaining on the list. I can imagine the supplies, the various phases that we're looking at. I think you're on mute, Mona. There we go.
I think you muted me. Supply and demand certainly is one of the most important issues that we face. And certainly we are partnering with our local health department as well as Spectrum Health Lakeland to be able to provide for those individuals and clinic organizations to be able to provide those vaccines. Now, for particularly in Caring Circle, when we started to roll out our vaccines, not only were we cognizant of those individuals that we serve, but their primary caregivers, because it's very, very important that they would be able to be provided that access as well. And so it's a matter of timing to be able to get everyone in, but they're certainly on the list to be able to be rolled in as quickly as possible as the vaccines roll out. And I know that with the community-based clinics that are coming up, that the allotment is increasing as time goes on. So more people will be able to be served. I believe that with the community-based services with Lakeland and Spectrum specifically, the rough estimates for Moderna were over 7,300 individual vaccines and 4,600 for people 65 and older. And there were, for Pfizer providers, over close to 2,000 for 65 and over that have been distributed and in the arm.
So I imagine you're hearing a lot from these older adults, and for many who are in what's considered the sandwich generation, right? You're caring for your parents, you're caring for your own kids. What have you done, or maybe what are the conversations surrounding those older adults that may not have that support system to rely on to get the critical care they need, to get to the places they need to get to in order to get the vaccines? How are the medical staff trying to meet people where they're at if they are in those situations, Mona?
Well, that particular population is exactly who we serve. The vast majority of all those we serve are homebound, number one, and number two, may already be disadvantaged by age, by limitations of financial resources, transportation, and are already reliant heavily on the community resources that we help to support and provide. One of the first things that's happened with the advent of the pandemic was really the initial panic amongst all of our patients, and probably maybe not as admitted by the medical community, but we were in knockdown mode to be able to attend to care in a way that we had never, ever needed to provide before. So our learning curve was really on a steep track as well. And one of the things that we started doing was the Caring Circle COVID call. We started immediately in March when we got locked down to contact each and every patient home to be able to let them know we're here, we're a phone call away. We may not be able to be there, but we're a phone call away. And those calls continued 500 strong every month plus for our entire organization for month after month after month. And I cannot even tell you the importance that initial outreach really provided that comfort to those patients who, although they were socially distancing and certainly isolated, but they knew that there was someone there who was calling and reaching out to them. Mm-hmm. And that made all the difference in really establishing and cementing a deeper trust in the providers and the service provision individuals. And that really started the ball rolling as far as the trust and the information, because it's not just a pandemic, it's an infodemic for our seniors. And those who are socially isolated, who don't have additional need to be able to continue to get meals, to continue to get home care in there, because as essential workers, we were not sitting home, we were essential and provided that life force for them.
Well, so many different layers to consider when we talk about this. I hate to be, bring it down to a sad level, but of course, the fact of the impact of older adults and the fatality numbers. And David, seeing as many clientele as you have been throughout this process, I can imagine there have been some certain circumstances. Could you talk to that about that in regards to the fatality rate and what you've seen?
Well, I think Ottawa County Health Department and other health departments have done a great job giving us some of the data of how many cases, and you can go to the websites and this kind of thing to see it. And if you go look at it and you look at the fatality rates for the older adult community, and right away the health community identified that this would be most lethal to the older adult. They'd be most vulnerable. And 11 months later, it continues to be true, not only in our area, but everywhere throughout the country and quite frankly, the world, that the older adults are most vulnerable to this. And it's fairly lethal. In other words, over 60 years old, I think it's somewhere around 94% of all the fatalities have been people over 60 years old. As a result, you can see where the older adult community then is appropriately afraid and terrified of this crazy virus and saying, what can we do to get protection, right? And then all the loved ones who care for them also are afraid to potentially give it to them. So you've got a combination that really affects the social fabric of us as a community when this phenomenon is going on. So as a result, all of the social agencies and health departments trying to quickly now get this vaccine to the older adult population first is so critical, because they are the most vulnerable. And so anything that we can do collectively to figure this out and work together to accomplish that goal will absolutely get after this issue of the fatality rate of the older adults, right? So that's probably that biggest cry where, again, the question, the 71-year-old who's looking for the vaccine and the 90-year-old who's looking for the vaccine, it's critical that we figure out how to get it to them as soon as possible, right? So, and I think it's already been brought up, a high percentage of this population is not going to anytime soon jump into the internet space or an email space or a smartphone space. And so therefore, we're going to have to figure out how to communicate analog and through phone, and also then reach out and figure out a system to have them sign up as well.
Absolutely. And we'll talk about some of the creative ways that's done in just a bit. I want to turn to Bill now. Bill, it's as you know, if your worlds are a bit parallel in that you are a retiree, you're a member of the community you serve. Can you share your own experiences during the pandemic with getting a vaccine that you're bringing to the senior center?
Well, I'd be happy to, Jennifer. One of the things that I decided early on was that as someone in the senior population, as well as a leader here at the senior center, I noticed in our population that many people were very anxious to get the vaccine, but there were also a significant number of people who had great anxiety about the vaccine and were somewhat resistant to it. So I immediately signed up for it. And in fact, later today, I'll be getting my second vaccine shot, because I wanted to be able to say to our senior population that is perhaps nervous about doing this, that I've experienced it. This is my reaction. I've had no problems with it. The vaccine is very safe. And so we've tried to use personal experience to encourage people to get this vaccine, which we think is so critical for the senior population. And we're doing the same thing with our team members who go out to people's homes and drive them to medical appointments, encouraging them to get the vaccine so that not only are they protected, but also the clientele that we serve are protected. And we have also been working those phones very hard. We have people who are calling all day long to talk to our seniors, see how they're doing, encourage them with the vaccine, help them to learn how to sign up, and in some cases even have them provide their information to us. And if they don't have internet access and can't get through on the phone, we will help them sign up. And so we've been partnering with our local health department, which has been doing an heroic job and working closely with them. In fact, they even have invited us to help them contact some of the people on their wait list to sign them up for their clinics. And recently, our excellent local hospital, Spectrum Health Local Ludington Hospital, has joined this fight and is providing vaccine along with the Meyer store. And we're very glad to have all of those people working very hard to get the population vaccinated.
Bill, thank you so much for sharing that. I want to just say hello to those who are joining us during our conversation. We're at the midway point right now. You can see this time around, we've brought on some interpreters and we appreciate their time. We have Laura Clark with us, and now we're going to switch off to bring Lydia Hansen to the screen so they can continue to provide the sign language that some of our older people and those who are joining us may need at this time. Again, our conversation today is about the vaccine and those in our older populations. And I want to just reference for a moment, there is a lot of chatter happening online and on the platforms that we are streaming on at this point. We are also sharing information back to you. So if you have questions regarding the vaccine distribution, please check in the chat. We're listing some links to get you to where you need to go for those who have the internet access. And we also want to just reiterate something that Mona had said earlier. We understand that various organizations, depending on where they're at, receive their vaccine supply on a week-by-week basis, and their quantities may vary, which of course that has been making it a bit of a challenge to make sure that we have the signups happening when they need to. I want to go back now, however, to a point that David made about communication and and making sure we are reaching out to the older population in the most effective way possible. And so I'm going to bring Allison and Danielle to the forefront of this conversation. Can you share with us some of the creative ways, because you are, in some cases, very much the touch point that these older people have in order to get that critical information? What creative things have you done?
Yeah, I would say just making those phone calls. Just getting on the phone and calling all of our clients. And we knew that there are certain clients that are kind of the fire spreaders, that as soon as they got word, they would call their tree. So really just getting on the phone and calling.
In paper, through publications. We have some free flyers in our area that a lot of people pick up. We have a paper here in the Newaygo County area that many people read. So we try to get that information not just through phone, but also through printed media, because that's more effective for most of our clients.
Yeah, absolutely. Can you share any instances? You spoke about those who are kind of the voice. They share the information as soon as they get it. How are they doing it? Are they usually using the phone as well? Because at this point, obviously they're still having to keep safe.
Yes. Yep. They are, from my perspective, they are struggling because they are those social people. And right now, social isolation is a real thing. And they are wanting those connections again. So yeah, they are still communicating with one another. I've seen them meeting up as well. We do grab and go meals, and they will sit in our parking lot and sit in their cars and talk from car to car because they are wanting that social connection still.
Mm-hmm. Yeah.
I love that. Okay, ladies, thank you for sharing that insight. David, I want to go back to you because we're talking about the challenges in communicating with our older populations, but then you bring in the layer of what you just said about your demographics, where you have maybe non-English speaking as their first language clients. Right. So how are you coping with that, with the Hispanic, with the Laotian communities?
Fortunately, we have on staff a number of our staff speaks Spanish, so we're fine in that particular category. We've asked a number of community leaders to connect with the Laotian community, so we had some interpreters come through our clinic who were able to assist in that area, so that both of those were able to work. Fortunately, we just started connecting to all the nonprofits in this area to try to help us put that clinic through the system. So what we're quickly discovering is that none of us can do this by ourselves. We really need to create ecosystems of help with other organizations to help us implement this kind of thing. And probably now more than ever, having those partnerships or forming partnerships to get that done has been really helpful. I'd also like to reinforce what Bill said about the safety of this vaccine. We've personally experienced having first doses in over 1,800 older adults. And as you know, they have to wait a couple minutes afterwards, 15-minute wait. And out of those who have waited the 15 minutes, no one has experienced anything negative. It's been a really good experience. And now doing the second dose. So from a safety standpoint, I've had 2 doses already. It really does work, and people, it's been a good experience so far. So, and there has been reluctance, but I think there's more overwhelming, when can we get it? And we'll probably talk later about some of the things that we can do as a health department and agencies to continue to reinforce how great this is to have this vaccine available. So.
Absolutely. David, thank you for that. I just want to take a moment right now to address some comments that are coming in through our comment section. Questions about the DeVos Place Clinic specifically, and support for those older adults who may not be able to stand for long periods of time as they wait, or perhaps maybe be in wheelchairs. We just want to reiterate that there is support available to help in those situations. So rest assured, don't let that that be something that will prevent you from bringing your parent or grandparent or those who may be in need of the vaccine because of those concerns? Again, we do confirm that there is support available for those instances. So let's bring Bill back on screen. And Bill, I want you to maybe speak more about your thoughts in regards to these community partners that you may or may be working towards developing relationships with in order to provide the critical care that your clientele needs.
Well, we have been engaged in significant outreach about this vaccine. For example, when our local Spectrum Health Hospital and Meyer began to provide vaccines, I went to both of them and got for our senior population exactly how they would need to go about signing up for the vaccine at those locations, and shared that along with the information about signing up through the health department. We've been doing a lot of outreach, for example, with food boxes that we distribute on a weekly basis. And we put information in that food box. So people are being fed information as well as food. And we've tried in many ways to do this kind of outreach with people to acquaint them with the vaccine and how to get it and to help them in any way they can. So we work with, we also have an advisory council here in addition to our leadership with the school district. Our colleagues at the schools provide the Meals on Wheels and all the senior meals throughout the county. And so we work with them with our newsletter and other information that we can share with all of their clientele. And those are some of the ways that we're trying to spread information in addition to our website, Facebook page, and other things of that nature. We have a lot of seniors in Mason County who are quite savvy with technology, but we have a significant number who are not. And so we do a lot of outreach with people, helping them in that regard.
Thank you, Bill. Allison and Danielle, I understand that the Council of Aging is part of a larger countywide collaborative effort. Could you speak to that?
Yes. Yes, we have some various partners in the community. And our biggest, I think, connection that we've done recently is the District 10 Health Department, especially in getting the vaccine out. Let's see here. Another one would be Spectrum. We received some, I called them goodie bags from Spectrum that had some items in them, mask, sanitizer, and then some vaccine information. And we provided those to our clients that receive our grab and go meals. So we've, yes, been working hard on just trying to get the information out so that our clients have those resources so they can make the best decision for themselves.
Show of hands, just curious to know if any of you are sharing the 211 or the state hotline for the seniors that you're working with. Okay, we've got majority of you doing that. That's fantastic. I want to ask specifically now, it was something that was brought up earlier, but Mona, we've been hearing more and more from different groups that we've been having conversations with that one of the hidden challenges with this pandemic, of course, is the impact of people's mental health. And especially, I would imagine, with the older population because of the fact that it's probably very limited in this case. Can you talk about maybe what you've been seeing with that generation? I think you're on mute, Mona. Gotta love technology, right? Oh, almost there. It's a quick click of the unmute. It's not working right now. Okay. All right. Well, we'll try to get back to you about that. David, you have spoke very openly about thoughts that you want to share in regards to the healthcare system. Is there something, in your opinion, that may be overlooked that needs to have a little more focus? And I think, David, you're on mute as well.
Boom.
There we go.
Okay, probably two particular areas. One, I think, and the health department can continue to help on this, is that there needs to be a special emphasis to how do we maintain a strong immune system. Clearly, this is a disease that's getting after those who have weaker immune systems, and older adults, because of comorbidities and the rest, will have a tendency to have weaker immune systems, of course. So how do we, while we're still in the pandemic and even afterwards, continue to emphasize how do we keep our immune system as strong as possible? Now, we also know that one way to do that is to socially and emotionally and physically connect and be with each other. So this is not helping our immune system by staying isolated in the rest. So there's a piece that we have to work through together to make that happen. So that's probably one particular area. And then the other particular area is that as we're coming, we're still in the storm, but we're moving through the storm, and hopefully, which I love the word hope, which is on Vaccinate, the page Vaccinate West Michigan, is that we continue to emphasize the goals and the deep need to have, when those vaccines start becoming more and more available, have the older adult population covered, and probably a call to action to help agencies like ours and others figure out how to reach, quite frankly, all the older adults that are in our communities as soon as possible as well. So just a concerted effort. I love what you're doing here today to bring awareness to this, but then how do we even put together teams to go after actionable items to make that happen with goals in mind to make it happen? Because by and large, a lot of agencies are doing this independently of each other as opposed to collectively working together.
Good points. So, Bill, do you want to add to that?
Well, yes, we are very strongly endorsing the vaccine. I mentioned our close association with DHD number 10 and the tremendous effort they're putting forth. Obviously, they have not been able to get as much vaccine as they have requested. And so they are doing everything possible to get this out to our senior population, and we applaud them for those efforts. So we want to not only, we want to also model the proper behavior. And so in terms of restarting our county-wide in-home services, we are sending out only those aides and drivers who have had the vaccine at this point, as I mentioned before, and we just try to reach out to the seniors in every way we can think of. We have a very creative staff that works here at the senior center, and we work closely with our elected officials and school officials and our advisory council and others throughout the county to try to cooperate in any way we can to get this population served.
All right. Well, we appreciate all of the efforts that all of you are doing right now. Again, we also appreciate the efforts of our interpreters today. I'm going to take a pause so that they can switch out. And as they do, I'd like you to think about maybe some final thoughts that you would like to share with those who have been joining us in regards to the efforts being made to reach our older people, our older population, and what we can continue to do to make sure that we are being very conscious in our efforts. And so, final thoughts, Allison and Danielle.
Yes. So my final thoughts are just, I guess, really a call to action on what each individual person can do to spread this information, to spread the phone numbers that people can call to get registered. If you're in Newaygo County and 65 and over, give us a call and we can assist with getting you on a wait list. But just starting to think about what more we can do to partner together throughout the communities. Where are the seniors going to? A lot of them are still attending church. So how can we get communication and resources to local churches, and that way maybe they can spread the information. So really just a call to action on what you can do to assist those older adults that live around you.
And sharing the best practices. We do have a lot of homebound seniors in our area, and it'd be interesting to find out ideas and ways to reach them with the vaccine to them, and how that might happen, and any ideas that people can help share to make that happen.
Mhm.
Absolutely. David, final thoughts.
Final thought would be to get some real clarity that we have today, especially I'll pick on Ottawa County, 25,000, I believe, who are registered, who are in need of the vaccine, over 65. So 25,000, if you get about 1,000 doses a week, that's going to be a while. So it would be that our community can start communicating, well, how many have already been vaccinated? How many do we have to go? And how are we going to accomplish that? Because we can lose hope, if you will, if we don't start seeing that we're making a dent and getting after this. So how we can do that and then communicate that not only through the website Vaccinate West Michigan, but also analog that we actually would send and the ability to send to all the older adult population. Here's where we are, here's our goal, and here's how we want to accomplish it together. And that we quickly kind of put that back in emergency mode of collectively making that happen.
And a good time perhaps to just remind people who are tuning in, we have a wonderful website that has details. And if we can pop that up just to remind people for additional COVID-19 vaccination information, there it is, spectrumhealth.org/vaccine. Bill.
Well, Jennifer, I would like to add that communication is so essential in this entire effort. We really appreciate what you're doing today to help spread the word about the vaccine and to encourage people to participate in it. We are going to continue working diligently to reach out to our senior population here in Mason County. And I know all of our colleagues who are on this call and around the counties that they serve are doing the same thing. And we want to implore our people to please go to trusted sources of information. The District Health Department, number 10, the CDC would be the sites that we strongly recommend that people go to for their information, because there is, I have to say it, there's not a lot of good help on general social media, and you need to really focus on reliable sources of information. This vaccine is very important. This disease is very terrible, and we want everyone to be protected.
Absolutely. And I think it's fitting that we end with Mona and just, final thoughts and how you will continue to work to ease the concerns of our older generation.
Well, you've just had a prime example of technical error that can certainly happen to our older residents in their homes as well. So it can be frustrating, as well as it can be an additional isolation to them. But I would just like to say that failure to thrive, which is the lack of human touch, has been exacerbated during this pandemic. Individuals who are already disadvantaged and already in vulnerable positions have lost that. They've lost the ability to communicate, to have that human touch, as well as to be able to have the freedom to know that someone can come in safely. At first, they were fearful for their own health. Then they were fearful for their family's health. And over the past 12 months, there has truly been a paradigm shift in how the seniors are reacting now that the vaccine has rolled out. And it's not a matter of, I want it for myself. Yes, they do. And they're telling me that all the time, but they're saying, I want it for my family. I want it for my grandchildren. I want it for future generations. And it becomes an issue greater than themselves. And I think that has given them hope. And it has moved them from refusal to hesitancy to acceptance of the vaccine. And I see that paradigm shift within the populations that I serve. And that gives me hope. And one of the most important things that they ask me, for those individuals who are in that refusal at the very beginning of the pandemic, is, have you had it? And I can proudly say, yes, I've had both of my vaccines. And invariably they will say, then okay, if you walked me this far, then I'm ready. And, I just have to say, if I could share just briefly one short story. My very first COVID patient that I had after our lockdown, was a woman of color, a matriarch of a multi-generational family. And she was the first one that had COVID on my panel. She survived, heroically she survived. Everyone in her family ended up with COVID, and they continued to be her caretakers. During that time, she developed breast cancer, and she was afraid to go back into the hospital. And it was only through multiple contacts and interactions with her in convincing her that she had survived COVID and she could survive the breast cancer, and that trust that was developed and placed, and that trust and transparency with the providers and her caregiving team, that she is now in remission, or not in remission, but continuing through services and is surviving.
That's
So
a fantastic story to end.
There's hope beyond that.
Let's end on hope then on this conversation. Thank you to all of you. Thank you to our interpreters for taking the time as well. And for you, our viewers, what we ask of you is to share this conversation. And you can easily do that by sharing this link to your own Facebook page, to your own circles, so that this continues to be a point of conversation for many of our families here in West Michigan. Again, thank you to all of you. We look forward to joining you next Friday as well for yet another conversation. And just a reminder, this is being recorded. So if you saw something, you heard something that piqued interest, you can always go back and rewind. For now, the additional information on the bottom of your screen is www.spectrumhealth.org/vaccine. We hope you all have a safe and wonderful weekend.